Well, she's the ABC News chief medical correspondent and has been on the front lines giving us the latest info we need to know. She's also a best-selling author. Her new book, The New Normal, gives us guidelines to deal with the COVID-19 pandemic. Welcome, Dr. Jen Ashton, to the show. Good to see you, Doc.
Hey, you guys. It's so good to be with you. I wish we could be together in person.
I know, Dr. Jen. I was telling you earlier, and Ryan, I feel like we already know you because you have been on the forefront, keeping us informed every single day of what's going on with COVID-19. So since we have you here on our show, what is the latest?
Well, in my capacity as chief medical correspondent at ABC News, obviously I've been eating, breathing, sleeping, drinking, everything this pandemic for over a year now, and in touch with the leading epidemiologists and public health officials. You can't imagine who's in my cell phone. It's actually surreal. But the latest is really that we seem to be in a better spot and improving. So we deserve a little celebration for that. But most people, again, are cautioning that this pandemic is probably going to go like this instead of straight up or straight down. And so now is not the time to take our foot off the gas.
Right. It's frustrating when you look at social media and you look at Facebook, and everyone seems like they're a doctor and they have all the answers and they don't know anything. And now all of a sudden people are not trusting our doctors. Is that what inspired you to write this book?
You hit the nail right on the head. And I just want to be clear. One question I get a lot is people say, well, I'm an OBGYN. How could I be an expert on COVID? And the reason that I have become an expert on COVID is because that's my job for ABC News. As you guys know, every single day I have to read the latest studies, speak to all of these experts, and basically decipher and analyze and interpret that for millions of our viewers. So I have been more current in this pandemic than a lot of people who are seeing patients 10 hours a day, because it's my job to be that current. And it has been all encompassing, to be sure. I mean, it really is a full 24/7 endeavor.
Right. And GMA3 was born out of this effort to dispel the myths.
Yeah, it sure was, you guys. And I'm going to tell you something. And I talk about this in the book. Amy Robach and I have been working together since 2012 at ABC. We were told on a Monday that 48 hours later, we were going to be launching a 1-hour daytime show called Pandemic: What You Need to Know. And we were literally just so busy covering the rapidly evolving virus and story that we said, okay, we'll just do more of it. And we have such a stellar team at ABC of bookers and producers that we were literally able to create GMA3, What You Need to Know, in 48 hours. And we're #1 in the time slot. And I think it really speaks to the fact that people want this information, but they want the inspiring stories as well. And so, Amy Robach TJ Holmes, I think there's no one better in doing what they do. And it's just a pleasure and a privilege for me to sit next to them every day.
Yeah, and separating fact from fiction is just so important right now. Are you hopeful that we're going to get back to a regular normal? Because I know it says the new normal on the book.
I would encourage people not to look back in the rearview mirror, instead to look forward and to be present in the now. And so I go through that in the book and try to give people the tools on how to think like a doctor, so that you're not hanging your hat on the medical whiplash that seems to be occurring as we learn new things all the time. And you can learn how to think like a doctor without 4 years of medical school. And I take people through that in the book. That way you can get to living. That's the key in the setting of so much uncertainty.
Right. And so much of this, too, in terms of COVID, is about being healthy and making sure we're taking care of our physical bodies to beat it, but also our mental health. What do you say to those people who are still not convinced to take the vaccine?
Oh, gosh. Well, in terms of the vaccine, I think we have to go by the risks of COVID that we know. And it's the risk of not just dying, which luckily, that risk is going down, but the risk of long haulers or post-COVID syndrome, which is anywhere from 10 to even 50% of cases, we really don't know how to manage that. And as there's a saying in medicine, if you're dead, you're dead. But if you have a long-term consequence that prevents you from doing your job or living your life the way you want to, that's a big deal. And that is a known risk. And then the safety of these vaccines, the short-term immediate safety is what is most important. And that looked excellent in the clinical trials, and the efficacy looks excellent. So when people say, well, we don't know about 10, 20, 30 years from now, that's absolutely true. And if we learn something 20 years from now, then at that point, we'll change our behavior. But right now, what we know is that these vaccines are safe, they're effective, and the risks of getting COVID are significant. So for me, it was an easy decision.
Yeah, we're learning more and more about long haulers, which you can explain a little bit more, but people that are still having the lasting effects. What percentage are we talking of people?
People don't really know. They don't have a good grasp on it. Some published studies, 30%, some 10 or 15%. Some published studies done both in the US and other countries are finding effects on the heart, lung, and brain of people who have had even mild COVID 6 months later. So we're talking about millions and millions of people. And right now, we don't have a lot of answers. So these people are really suffering. In some cases, they have some significant debilitation. And we're just kind of putting Band-Aids on their symptoms right now. So it's just another reason to lock down that, what I call in the book, trifecta of good health, which is getting good rest, getting good exercise, and being active and eating well, and taking that vaccine so that you don't run the risk of becoming one of those long haulers.
Yeah, I have a question because I have a friend that had COVID about 6 or 7 months ago. She still has very, very little taste, no smell. She doesn't know if that's ever coming back. Do you think that it will come back?
We don't know yet. It's too soon to tell, but that's a central nervous system consequence of COVID-19. And by the way, that's not a trivial thing. We need our smell to detect danger and smoke, and smell our food, and we need our taste to know if we're eating poison. So this is significant, and there are a lot of people suffering with that. And my best wishes to your friend. I hope she feels better soon.
Yeah, I same thing. I know people who still can't taste or smell. Well, Dr. Jen, we appreciate you filling us in, telling us a little bit more about the book, giving us some hope as well, and some tools to live by to make sure that we all stay healthy. And we'll be watching you, of course, on GMA3 and on all of ABC's platforms.
Thank you so much. And as soon as we can, maybe Amy, TJ, and I will come and we'll pay you guys an in-studio visit.
That
you guys
would be
are
lovely.
awesome.
Would
you do
love
an amazing job.
Thank you, Dr. Jen.
All right. Make sure you check out Dr. Jen's book, The New Normal. It's available now.